If you have back pain and that is radiating to your legs and you have been advised surgery, but you avoid surgery just because of the fear of surgery, long hospital stay, and prolonged recovery, this video is for you. I'm Dr. Ganesh, consultant neurosurgeon and endoscopic spine surgeon from Sunrise Group of Hospitals. Over the years, I've treated many patients from all walks of life, starting from IT professionals to a manual labor. But the common question comes about spine surgery is the persistent fear about spine surgery. Whether there will be a prolonged recovery, whether the patient will be able to walk just after surgery, whether he'll be bedridden after surgery. Today, I'm here to explain one of the major advancements in spine surgery, which is endoscopic spine surgery, which lets patient walk the same day after spine surgery, also with an incision size of less than 1 centimeter with less muscle damage. Nerve compression can occur at any age, even an adult population or an older population, and it can be caused due to simple disc bulge, or it could be because of lumbar canal stenosis, which occurs due to age, or even spinal tumors. So whatever the cause may be, the symptoms are back pain radiating to the legs, urinary symptoms, and sexual symptoms. Most of the spinal problems are usually recovered with just conservative management, medicines, physiotherapy, and rest. But certain diseases, when it is not amenable to conservative management, need surgery. Traditionally, spine surgery is always done by open procedure. The open procedure is even now the gold standard, but the problem with open procedure is that we'll have to give a longer incision so that the muscles are split, and which can lead to the muscle damage, and in a longer term the patient's pain persists. So with endoscopic spine surgery, just like the advancement in warfare, it allows us to deal with the spinal problems with a tiny incision as small as 1 centimeter, with patient walking the same day and getting discharged the next day. This is possible just because of the minimized collateral damage, because of the least possible muscle damage which is achieved with endoscopic spine surgery. To believe any procedure, we need RCTs, which compares the new procedure with the gold standard procedure. Likewise, today we have RCTs published in BMJ, which compares endoscopic spine surgery with the traditional open surgeries, and it has proven that endoscopic surgery is not inferior compared to the open surgeries. And in fact, it also says that it has less blood loss, increased pain relief, and early return to work compared to open surgery. So coming on to the benefits of endoscopic spine surgery. What are the benefits for a patient? So when you think of a patient doing endoscopic spine surgery, when the incision is very small, the pain is less. So when the pain is less, the patient is walking the same day, and when the patient can walk the same day, he can return to work as early as 1 week after surgery. And there are also proven studies which state that there is less blood loss compared to open surgery in endoscopy. There is also less infection rate. Overall cost analysis has also been assessed in many studies, which prove that the entire cost burden on a healthcare structure when the patients undergo endoscopic spine surgery is less compared to the open surgery. We recently treated a patient who's around 45 years old female, hailing from nearby place Thrissur. She was bedridden for 2 months. She was advised for surgery because of prolapsed intervertebral disc. She did not go for surgery just because of the fear, as everybody have, like paralysis, bedridden status, or any other problems. So we did surgery and she walked the same day and she got discharged 2 to 3 days after surgery. So this is the miracle thing which can happen after endoscopic spine surgery. Technology is just one part of the surgery. The major part is selecting the right patient, applying the appropriate procedure, and performing it safely at appropriate time. So my neurosurgical training at All India Institute of Medical Sciences, Delhi, has provided me one thing: no two patients are alike. So the best possible treatment for a patient is curated based on an individualized plan, based on their lifestyle, goals. Modern spine surgery is changing rapidly. Previously, the conditions which required bigger surgeries, longer duration of stay, and longer duration of recovery now can be addressed with endoscopy and minimally invasive spine surgeries. The goal today is not to provide a bigger incision, The goal today is to provide a solution without causing collateral damage, which is attained with minimally invasive and endoscopic spine surgery. So just remember these symptoms, and if you have these symptoms, just visit a spine surgeon, which include back pain radiating to your legs, the pain which is very severe, which is intolerable, waking you up from sleep, if you have urinary disturbances along with back pain, and if there is also sexual disturbance. So never ignore these symptoms. These are the symptoms in which you need to consult a spine surgeon as early as possible. I am Dr. Ganesh. Thank you for watching. I am looking forward to help you to move better and recover faster.